My name is Sanjeev Bhalla, and I'm a professor of radiology at Washington University, and I run the cardiothoracic imaging section here at the Mallinckrodt Institute of Radiology in St. Louis, Missouri. Immunotherapy pneumonitis often will look like other causes of organizing pneumonia. So I think the fundamental to making that distinction is to understand what the CT manifestations of organizing pneumonia can look like. Now, classically, one finding that's been described is a nodule, where in the center of the nodule, there's decreased density as compared to the periphery, and there may even be an area of lung that's spared in the center. This has been known as the reversed halo sign or the atoll sign. It was described originally with idiopathic organizing pneumonia, sometimes known as cryptogenic organizing pneumonia. But what we've learned over time is that this is much more commonly seen with medication-induced organizing pneumonia, especially somebody who's on immunotherapy. So if you see these kind of nodules that form with a central clearing, that's a really helpful finding. Now, organizing pneumonia and immunotherapy pneumonitis are very unusual to present with either lymphadenopathy or pleural effusions. So if we see those two, then they can kind of steer us away. Maybe we're dealing with an infection or we're dealing with recurrent tumor, but it's very unusual to get that, but either an effusion or lymphadenopathy in somebody who has organizing pneumonia from immunotherapy. Now, other findings that can occur, which kind of start to blur our ability to make the diagnosis, are that you can get areas of consolidation, and the areas of consolidation can look like an infectious pneumonia. The key is that they tend to be a little bit less segmental in their appearance. So they may cross fissures, they may cross into other lobes or other segments and look kind of funny, and that may make us think of that. The distribution on an axial image is one that they tend to either be very peripheral, so they'll be strikingly peripheral, or if they're central, they tend to follow along the bronchovascular bundles. That's known as being bronchocentric, and that bronchocentric distribution is very classic for organizing pneumonia as well. So when we have that reverse halo or atoll, we can be very confident that we're dealing with organizing pneumonia. When we have this peripheral or bronchocentric pattern, it's very suggestive that we're dealing with organizing pneumonia. The timing that it becomes a little bit more difficult is when sometimes there's a more diffuse appearance to the organizing pneumonia, and then that really relies on a correlation between the clinical history and the specimens that may be obtained from bronchoscopy. Now, with radiation therapy, which is another treatment that can result in either a pneumonitis or drug or a medication or treatment effect, we often will see what looks like an organizing pneumonia pattern, but it's restricted to the radiation field. And so that is very nice. And of the two, radiation is much more likely to take on shapes that are completely not anatomic. So you'll see squares, or you'll see often a rhombus type appearance, which mirrors the radiation field. What's a little bit tricky is that occasionally you'll get patients with lung cancer who've been irradiated and they are doing well. They'll be started therapy, and the therapy will result in radiation, will result in organizing pneumonia in the radiation field. And this is known as radiation recall pneumonitis. And essentially it's organizing pneumonia that exactly matches the radiation field. And then you have to just rely on your timing of when the patient received the radiation in order to feel confident in making the diagnosis. So that's when it gets a little bit tricky. But the key is to be really familiar with the findings of organizing pneumonia and understand that the protein manifestations have all been realized by the pneumonitis that forms from immunotherapy.